Health economics allows us to look at what is the relative gain for dollars spent on particular services. What would we be better spending precious public money and private money on to get the best long-term outcome? That's a serious economic analysis. That's a serious economic benefit. And guess what? It makes an important difference to governments, to families, to others to choose to be involved in this area. We need to show which of the things we're talking about are really strong economic value along with their social and health value. That helps to make better decisions and people to invest in this area in the long term.
What we're doing in the economics component of this project is adding costs, of course, but also accounting for health benefits, which is the most important part of what we're trying to achieve here. And by including all the different economic elements in there, we can identify those interventions that are cost-effective, those that are not cost-effective, which means that we can make better investment decisions about where to direct funding when it comes to providing the right care to the right people at the right time. When we talk about whether an intervention is cost-effective or not, we don't mean that it needs to be cost-saving. Interventions that increase costs and require more investment to implement can actually be cost-effective because of the health outcomes that they achieve. Those health outcomes, that improvement in population health, outweighs the additional investment, and so then you'll know that you're getting the best value for money that you can. And so that's one of the misconceptions that I find about when we refer to something as being cost-effective or not.
So for the model, we usually use data from Australian Bureau of Statistics and also Australian Institute for Health and Welfare. And then for each region, we will request data from the health departments from that region.
There's also a number of other government organisations that collect costs from different parts of the healthcare systems like hospitals and primary care. And so there's a whole range of different data sources, most of them public, that we can get high quality data from and use it to estimate the costs of different parts, the different cogs and wheels that are turning in the model to make sure that we're accounting for costs as we change different parts of the system as we turn interventions on and off.
So we would like to cooperate with the sites and have a more accurate data from them, is maybe from the local government or local PHN or local NGOs or other clinical organizations that have data that can contribute to this model.
It's very important to have data, economic data from the region itself, because different regions has different attributes to it. So we want to capture those differences in the data. Understanding those differences through the data is very important to actually give results that represents the region's characteristics properly. I think that's the reason why it's very important to have data from each region.
The main thing I love about health economics is that it means we can make a difference in people's lives. The decisions about how money is invested by the government and other organisations in the healthcare system, those decisions are going to be made regardless of whether we've got evidence in there or not. And so I think health economics and economic evaluation gives us the opportunity to have a transparent and detailed and explicit framework that we can use to bring in information from a range of different sources to essentially make better decisions, and better decisions where more people are involved, better decisions because more information and better evidence is involved. And all of these sources of information and data and evidence is funneled through the system dynamics modelling that we're doing, and means that we can produce high quality economic evidence to make better investment decisions. And the reason that's important is because when you make better investment decisions, you're getting better outcomes. Better health outcomes is what we're specifically after.